For millions of people, healthcare doesn't start at a hospital or a doctor's surgery. It begins on the high street. This chart shows the latest financial settlement for community pharmacies in England. The headline budget for the next year is £3.636 billion, a £340 million increase over previous levels. The government is framing this as a definitive stabilization of the sector. They've promised to write off millions in historic debt, calling it one of the largest budget uplifts anywhere in the NHS. On paper, an injection of cash on this scale should secure the future of these neighborhood health hubs. But the moment you step off the paper and look at the actual accounting ledgers on the ground, that stability disappears. Data from a recent sector survey shows that 75% of pharmacies are now operating at a loss. Only 14% report being profitable. Those deficits have immediate consequences. Over 40% of pharmacies have reduced their opening hours, and 1 in 10 are currently unable to pay their wholesale bills on time. This is the central paradox. How can a sector receive its largest funding increase in years and still face a £2 billion deficit? This deficit is the result of a decade where government funding for pharmacies remained almost completely flat. Meanwhile, the cost of wages, rent, and energy rose year after year, creating a structural gap that new settlement money hasn't closed. The financial pressure is rooted in the medicine margin. This system determines how pharmacies are reimbursed for the drugs they dispense to the public. This diagram shows the problem. For many medications, the NHS reimbursement price is lower than what it costs the pharmacy to buy from a wholesaler. 99% of pharmacies now dispense medicines at a loss, effectively paying out of pocket. The fundamental business of providing medicine has been transformed into a guaranteed financial loss. To ease the pressure on hospitals and GP surgeries, the government is actively diverting patients directly into community pharmacies. That shift has a massive impact on workload. Over the next year, pharmacies are expected to process an additional 32 million prescriptions. On top of that volume, pharmacies must now deliver 3.2 million more clinical consultations, including new responsibilities for independent prescribing. That £340 million funding increase has to cover the staff, the technology, and the governance required for all of this extra work. It is quickly consumed by the cost of the new mandates. This creates an activity trap. The more the government relies on pharmacies to pick up the slack, the faster their operational losses grow. These financial pressures move from the balance sheet to the consultation room. 76% of pharmacies report that their financial situation is now affecting patient care. For the public, this means longer wait times and delayed access to essential medicines. Pharmacists are now forced to spend hours every day navigating widespread drug shortages, searching for basic medications that should be readily available on the shelf. The financial decline of the local pharmacy is the steady erosion of a neighborhood's primary healthcare safety net. Despite knowing the settlement was inadequate, Community Pharmacy England accepted the deal. They viewed the funding strictly as life support, accepted only to keep the lights on while they continued to negotiate for the sector's survival. This chart shows the reality of that agreement. The £340 million uplift is dwarfed by the remaining £2 billion deficit. Without a complete reform of the funding model, the ongoing deficit will eventually collapse these local hubs, right when the NHS depends on them most.